Top 10 drugs interaction. And here I like to select those top 10 drugs from narrow therapeutic index drugs and their drug interaction, how that affects on increased risk of those narrow therapeutic index drugs toxicities, or by increasing their serum concentrations, or how can they influence on by changing their serum concentration by making those drugs ineffective. So let's start off with narrow therapeutic index. Well, narrow therapeutic index drugs are the drugs that have low therapeutic index. That means is indicates the low safety margin of the drug. So, a therapeutic index is calculated based on toxic dose, which is TD50, and divided by effective dose, which is ED50. What is that TD50? TD50 is median dose causing toxicity in 50% of population, whereas effective dose is a median dose producing desired effect in 50% of population. So if this therapeutic index is low margin, generally less than 2, generally it is considered as narrow therapeutic index drugs. Well, let's take an example. If a drug has TD50, which is a toxic dose, 50 is 40 milligram, and effective dose is 20 milligram, then if you calculate them, like 40 divided by 20 gives you the 2. That means, according to the FDA, drugs with low therapeutic index that has a low safety margin, that means less than 2 therapeutic index drugs are considered as narrow therapeutic index drugs. So, to explain these effects of the drug interactions on these narrow therapeutic index and that causing their toxicities and drug ineffectiveness, let's look into details of types of drug interactions. Well, here in this presentation, I like to primarily present how these narrow therapeutic index drugs are affected by severe drug interactions. There are two ways these drugs are primarily affected. Either drug interaction can result into increase in the serum concentrations of these drugs, and that results into toxicity of these drugs or narrow therapeutic index drugs, or the decrease of those concentration can result into ineffectiveness of these drugs. So here, based on these types of drug interaction, how these narrow therapeutic index drugs effects can be explained from drug and drug interactions. By drug and drug interaction, drugs serum concentration can be increased and can result into serious toxicity of those narrow therapeutic index. For example, drug and drug interaction further can be divided into pharmacokinetics. That means by increasing in those distribution or having a tissue binding effects or serum concentration increase or decrease in renal clearance can result into serious toxicities of narrow therapeutic index. And additionally, drug and food interactions can also result into increase in those drugs concentrations. As a result of those drugs can cause narrow therapeutic index can cause toxicities. And additionally, other drug interactions such as drug and herb interactions, certain drugs such as grapefruit juice or also other substances such as St. John wort can result into inducing those drug activity and can decrease their concentration as well. So let's see in details of each of these drug interaction. So here I like to select top 10 narrow therapeutic index drugs that is given recommended by FDA. So first drug here I like to start off with warfarin. Warfarin is an anticoagulant, which is an oral anticoagulant, well known for lots of drug interaction. Because warfarin is mainly metabolized in liver by CYP enzymes, which is cytochrome isoenzymes such as CYP2C9, 2C19, and also all the way till 3A4. Primarily, these effects are seen by 2C19 and then also 3A4, and then 1A2 interactions. Well, changes in the warfarin serum concentration can be monitored by using a lab test that is called INR. INR for International Normalized Ratio. What that means is it standardizes the prothrombin time. This means a prothrombin time measures the blood clotting time. Normally, INR is a ratio which is a 1. However, when there is a INR increases, that means is increase in INR means the warfarin effect is increased. That means that can result into risk of bleeding. And certain drugs that can increase the effects of warfarin, such as amiodarone, fluconazole, and SMX-TMP, sulfamethoxazole, trimethoprim, and also very strong inhibitors such as macrolide clarithromycin. Especially among them, amiodarone and also amiodarone and SMX-TMP, sulfamethoxazole, trimethoprim, have significant drug interaction with warfarin. Whenever these drugs are added or removed from the patient medications, then patient need to be monitored for their INR. There are drugs, they also reduce the INR, that means they reduce the effect of the warfarin, that means they increase the blood clot risk. Like for example, CYP enzyme inducers such as carbamazepine, phenytoin, phenobarbital, rifampin, senjoinvert, they're known to decrease the INR effect of the warfarin, and that can result into increased risk of clotting. Well, there are some other drugs significantly increase the risk of bleeding, especially thrombolytics, like alteplase or tenecteplase. Those drugs are known as thrombolytics. Those are completely not combined with warfarin. However, other medications such as NSAIDs and other anticoagulants and antiplatelets, such as low dose of aspirin, clopidogrel, ticagrelor, those medications added with warfarin. However, they require frequent monitoring of INR to minimize the risk of bleeding. Well, here are further more details. The most and therapies maintain INR between 2 to 3. However, patients who have a mitral valve are those are maintained with the 2.5 to 3.5 INR. And patient taking warfarin should be monitored for lab results of INR and also monitor liver function test. Well, major toxicities mean this can result into abnormal bleeding or excessive bruising. A melena means that can be a black stool that can be sign of bleeding from the gastrointestinal tract, or persistent oozing from injuries can be sign of warfarin overdose. In that case, those management of toxicity of warfarin is done by, in case of bleeding, vitamin K, or excessive bleeding, fresh frozen plasma is used for managing warfarin. So what are those takeaway points? For most exams, questions on warfarin is about these metabolizing enzymes. This happens in the liver. The site of this metabolism takes place in the liver, especially 2C9 and 3A4 plays significant role in this one. Among the drug interaction, most exams test about amiodarone drug interaction with warfarin and about carbamazepine drug interaction with warfarin. Those are significant takeaway points, and also the monitoring for major toxic symptom are also commonly tested questions. All right, let's go to the next drugs. That is the most important drugs among all nanotherapeutic index drugs. That is digoxin. Well, digoxin is most narrow therapeutic index drug for all. That means small changes in the serum level that can result into serious toxicities. So here, digoxin is not metabolized by cytochrome enzymes. Well, digoxin is metabolized by P-glycoprotein as a substrate, which is a unique, which is a glycoprotein which is a transporter in the gastrointestinal tract, and which is digoxin is the substrate of that one, and additionally partially metabolized in the liver, and also digoxin is metabolized by intestinal bacteria. So these are the few key points for digoxin that results into serious drug interaction. So there is one beautiful mnemonic that is commonly used for digoxin toxicities, that is also known as digitalis toxicity. The mnemonic is Q-TEWA, Q for quinidine. Quinidine increased digoxin levels, and thus therefore it decreased the clearance. And here tetracyclines inhibit the gastrointestinal bacteria. As a result of that, have a more free digoxin and increased digoxin absorption. Erythromycin does same as tetracycline, and verapamil increased digoxin concentration about 50 to 70%. Additionally, verapamil also caused the increase in bradycardia, means increase the heart rate, decrease the heart rate, which is both of them, digoxin and verapamil, both of them cause bradycardia. Combine those can cause severe bradycardia. And often tested question is about amiodarone. If you are using amiodarone with digoxin, it is important to reduce digoxin dose by 30 to 50%. And next, about the digoxin therapeutic range is nanograms, which that means that tells you how sensitive that can be. And also important lab monitoring for this is potassium, magnesium, and importantly, the most important is renal function test. That's a common test question. Well, digoxin, in case of patients who have a low renal function, a severe renal functions, then digoxin dose have to be reduced. Otherwise, it can result into digoxin toxicity, and there are severe nausea, and there is a blurred vision, or also can cause green yellow vision. And most importantly, often question about in case of overdose, it can cause ventricular arrhythmias. That's a serious toxicity of digoxin. So in case of digoxin toxicity, that is managed in the emergencies by antidote, that is a digibind, or also known as digifabs. All right, let's go to the next drugs, that is a lithium. Lithium is a big deal, often tested questions in the many board exams. So lithium is about the, here two major drug interaction. One is the drug and food interactions, especially in terms of food means caffeine. Caffeine, if you're using especially with acetaminophen, codeine, caffeine combinations are available, like such as Tylenol brands, Tylenol 1, 2, 3, 4, they do contain 15 milligram of caffeine. Additionally, if patient drinks lots of caffeine, or like 5, 6, 10 drinks of caffeine, eventually can affect on the lithium concentration. So therefore, those patients require frequent monitoring. Most common tested question in the lithium is about sodium intake. Sodium intake have to be maintained consistency. Do not change. Don't increase the sodium intake or don't suddenly stop taking it. Both can result into lithium toxicity because sodium is reabsorbed from the nephrons, proximal tubules, where lithium also equally same atomic size of sodium. So therefore, whenever low sodium, lithium will reabsorb and thus increase the lithium levels in the blood, and that can result into lithium toxicity. Well, other than the food and drug interactions, there are drug and drug interactions, specially related to not the cytochrome, but mainly that is sodium. Any drug that decrease the sodium or increase the sodium water retention, then they result into toxicities such as NSAIDs, diuretics, ACE inhibitor. Those require monitoring when you are using with lithium. Well, here lithium toxicity questions are very frequently tested in the exam, especially lithium if it is serum levels are more than 1.5 milliequivalents per liter, that can result into lithium toxicities. So patient taking lithium should be monitored for renal function test, and also lithium can cause hypo or hyperthyroidism, therefore serum TSH have to be monitored, and monitor sodium levels for that one. Where classical symptoms of lithium toxicity is coarse tremors and also can cause confusion and seizures. Those are the three serious symptoms of lithium toxicity, and those are often tested questions. Big in the exams are about lithium toxicity levels, that is more than 1.5 milliequivalents per liter, and then that can result into those tremors is an indicator of lithium toxicity. Next, other important drug is phenytoin. Phenytoin is a well-known drug for its serious drug interaction, and also according to FDA, it is considered as narrow therapeutic index. So here there are two major types of interactions here. One is about phenytoin, very special about protein binding. Phenytoin has more than 90% protein binding. That means lots of phenytoin is bound to the serum protein, mean that has a less distribution and also have more drug stays in the blood. That means drugs that are more protein affinities, they can displace the phenytoin and can make free phenytoin or unbound phenytoin, and that can result into toxicity. Not only that, there are some conditions such as severe renal and hepatic failure or hypoalbuminemia. Those conditions, there is more free phenytoin. So therefore, when you're calculating the dose adjustment for phenytoin, and there is a different formula need to use for calculating free fraction of phenytoin, because only free fraction of phenytoin that produce the clinical effect. So therefore, those formulas that are used for calculating phenytoin dose, they utilize free fraction of phenytoin in those special cases such as hypoalbuminemia cases. Well, another important drug interaction of phenytoin is a strong inducer of several CYP enzymes, CYP2C8, 2C9, and 3A4, and also P-glycoprotein. Phenytoin is known to reduce hormonal contraceptive effect, so therefore that require extra precautions while taking phenytoin. And phenytoin dose adjustment is very tricky because it's after certain concentration, therapeutic range, after above 20 micrograms per ml, or you can say milligrams per liter, that concentration drug can be switched to the saturated kinetics. That means that saturated kinetics can result into more phenytoin toxicity symptoms. Well, since phenytoin affected by albumin, that is a major protein in the blood circulation, so therefore have to monitor albumin, liver function test. And most tested question, the big in the exam is about the toxic symptoms of phenytoin. Phenytoin toxic symptoms include nystagmus. That means is rapid eye movement, or ataxia, losing the balance, or mainly these are CNS toxic symptoms. So therefore, those require watching for those patients, especially if you are taking phenytoin intravenous dosages in case of status epilepticus patients. All right, next drug is the big one is carbamazepine. Carbamazepine is known for lots of drug interaction because carbamazepine is a strong inducer and substrate of 3A4. That's the big thing. That also known as autoinducer. That means is carbamazepine metabolizes its own products. That means it induces those CYP3A4, and that also substrate for that. Not only that, carbamazepine also induces the 2C9 that plays very important role, and 1A2 as well. And one big thing about carbamazepine is it has a genetic polymorphism. That means those patients who have this HLA or human leukocyte antigens, these genes, they can produce variation in response. However, this effect is related to carbamazepine allergic reactions, which causes the Steven-Johnson syndrome. All right, next here, the drugs that increase the carbamazepine concentrations are CYP3A4 inhibitors. They increase carbamazepine concentrations such as macrolides, clarithromycin, fluconazole, and there are various drugs also decrease carbamazepine concentrations such as CYP3A4 inducers such as rifampin, phenobarbital, and phenytoin. Well, most commonly tested question in the exam is the interaction between warfarin and carbamazepine that is coming because of CYP2C9 and 3F4. So, however, CYP2C9 is a big one for warfarin and carbamazepine that require monitoring for warfarin dosages and also carbamazepine serum levels. Well, carbamazepine overdose can also cause CNS or hematological side effects. Next, another important drug for narrow therapeutic index is cyclosporine. Cyclosporine is used for organ transplant rejection minimization. That means patient who undergoes organ transplantation, they often have a risk of rejection of those transplant through their after organ transplantation. So this medication is very important medication for the treatment for immunosuppression effect that caused by organ transplantation and to suppress the organ transplant rejection. So therefore, this is also known to have severe drug interaction because cyclosporine is a substrate and strong inhibitor of CYP3A4 and also inhibitor of P glycoprotein. So therefore, it is often involved with drug interaction with commonly used drugs such as statins, digoxin, colchicine. Perhaps digoxin interaction is coming from PGP, P glycoprotein. All right, so P glycoprotein is a type of is a transporter in the cells, and that helps to efflux the drug from inside the cell to outside the cell. So, which is digoxin is a substrate of that one that can be resulting into drug interaction. Well, the another big thing about the cyclosporine is nephrotoxicity. It can cause irreversible kidney damage. So therefore, if you're using other drugs that has a nephrotoxicity such as cisplatin or also NSAIDs or any other drugs like radiocontrast media that require extremely precaution because that can put into severe nephrotoxic situation. Well, the toxic symptom obviously related to nephrotoxicity. It can shoot up the blood pressure because it can alter the blood pressure because of those changes in kidney function and also cause gingival hyperplasia. What means is it causes the swelling of the gingivas. All right, next drug is tacrolimus. That's another big one. Tacrolimus is primarily metabolized by CYP3A4, and this one, there are many drugs such as CYP3A4 inhibitors, amiodarone, ketoconazole, fluconazole, diltiazem, macrolides, including grapefruit juice, they significantly increase tacrolimus level. So, auxiliary label required to monitor, avoid grapefruit juice with this medication. That's a tested question. Whereas there are drugs, they also decrease tacrolimus levels, such as carbamazepine, phenytoin. When I say this medication, you feel like these are simple CYP3A4 inducers. So these inducers decrease tacrolimus level. All these drugs require monitoring are required to avoid if possible. Well, this drug also known to cause nephrotoxicity like cyclosporine. There are several similarities to the cyclosporine in terms of toxicities. So avoid drugs that are considered as nephrotoxic drugs such as aminoglycosides, cisplatin, NSAIDs. These drugs can deteriorate the blood pressure and can alter the serum levels. Well, these drugs also overdose can cause nephrotoxicities, tremors, and hyperkalemia. Next one is about theophylline. Theophylline is another narrow therapeutic in drugs. It is primarily metabolized by CYP1A2 and also CYP3A4. These two are the major enzymes. Theophylline, although less commonly used nowadays, but it is known to have severe toxicities. Especially one major drug interaction that is commonly expected in the exam, that's big in the exam, is by ciprofloxacin that cause interaction with 1A2. So ciprofloxacin is a strong inhibitor of 1A2, whereas theophylline is a substrate, therefore that can cause increase in theophylline toxicity. So whereas you can still use moxifloxacin, levofloxacin, they do not have these effect on CYP1A2, therefore that can be still used. Well, when it comes to the halothane can increase the arrhythmias, toxic symptom. Influenza vaccine should be avoided with this because it increase the lithium toxicity, theophylline toxicity, and other drugs that include methotrexate. Well, there are several drugs that also decrease theophylline levels, such as marijuana, smoking, tobacco, phenytoin, carbamazepine. Those are inducers of 1A2. So therefore, they even results into decrease in theophylline effect by increasing rapid clearance of those medications. Well, this is the case, one of the case, whenever you're calculating dose for theophylline, this is the case you use ideal body weight. Very rarely use ideal body weight for calculation. In this case, it is commonly used ideal body weight. Well, the major toxic symptoms are often questioned in the exam. It causes the ventricular tachyarrhythmias and seizures. Those are serious toxic symptoms of theophylline. And those toxicities can be reversed by beta blockers, which can reduce the tachyarrhythmias. Next, important narrow therapeutic index drug is phenobarbitals or barbiturates. Phenobarbitals are strong inducers of 3F4, 1A2, 2C9, 19, which is same as carbamazepine phenytoin type. And this can result into two major concerns: a decrease in loss of effectiveness if you are using with other inducers, or if you are using with inhibitors can cause frank toxicity of the drug, and therefore in discontinuation of this drug also can result in those toxicity if you are using with drugs that are inhibitors of phenobarbitals. Well, phenobarbital also has one important issue. It also used for lowering hyperbilirubinemia in neonates because it lowered the serum bilirubin concentration by inducing glucuronyl transferase. That's a big enzyme that you should keep in mind. So that is part of this bilirubinemia process. Well, major toxicity of phenobarbital is respiratory depression and can drop the blood pressure. And of course, that can cause severe sedation. All right, last drugs, according to FDA, top 10 neurotherapeutics is levothyroxine. Sound like a levothyroxine is a commonly used thyroid hormone, seems like a very safe and of course very stable drug. However, it can result into toxic symptoms of hyperthyroidism. But drug interaction, it does not have a CYP enzyme interaction. However, it does complexation with iron, calcium, antacid, and of course food. The auxiliary label is commonly tested question is levothyroxine must take empty stomach or take first thing in the morning. Well, levothyroxine, main toxicities happen because of overdose of giving them. Over supplementation, that means doses comes in micrograms. So if you go for very high dose like 150 microgram or 200 microgram, sometimes it can result into hyperthyroid side effect. So therefore, this dose have to be gradually increased from 50 microgram up to the 100 and so on, as per based on the serum TSH monitoring. The lab test that is monitored is serum TSH and free T4 level, thyroid, um, levothyroxine patient taking them. TSH and free T4 level should be monitored. That TSH level should stay within the 5, more than 5, considered as a hyper thyroidism. So therefore, that can produce the tachyarrhythmias, heat intolerance, diarrhea side effects are commonly affected. Well, like this, stay up tuned. We will have a more other drugs, drug interaction, the serious complications that are most tested in the exams are coming up. So stay tuned and subscribe Pharmacy Prep channel. Until then, thank you. See you again.